Welcome to our road to equality with our queer nation. This is Q&A with Amanda. When did you first become aware of the desire to live your truth?
I first became aware of my desire to live my truth after a little bit of a negative experience with a peer of mine who said that I was hiding behind a mask when I started dressing as a woman for purposes of entertainment. And entertainment being, I was a drag entertainer and out in LA trying with the desire to make it big and be the next drag superstar, so to speak. But this desire was urged on by each challenging experience that I've had from peers. It brought me closer to my truth and closer to me realizing that I wanted to live it, which brought me back to that childhood desire and that childhood feeling of me naturally feeling like I was a girl. It was as far as back I can remember, as far as 3 years old, I did do the stereotypical things of playing with Barbies and having just all girlfriends and whatnot in the neighborhood, and I was effeminate and whatnot. It was just a natural sort of process for me to undertake this path of transitioning to a woman full time.
And how did you know that this was the path for you?
I knew that this was the path for me through a lot of soul searching and a lot of research and reflect back from, again, when I was a child and whatnot. And I did go about the proper procedures of researching as far as the actual hormone therapy went. I read articles and things of that nature and looked for videos and whatnot of other points of references that I could possibly get. Unfortunately, there aren't too many videos of other trans women documenting their experience with in regards to hormones and what those bring about. So I did get a lot of, fortunately, intelligent, correct, pointed references from friends and peers of that nature here in my hometown of San Diego, as far as that goes. And one of those being my Finding Family Health Services Center, where I was pointed to a specialist who also pointed me in a direction of a professional doctor, where I was told to instructed to make a 5-year plan, so that way they were making sure that this wasn't some flighty sort of idea that I had, that this was something that was well thought out and something that I was prepared for.
And tell us, what are the things to consider before going through this procedure?
The things that I considered before taking on the actual step of taking this female estrogen into my body, where I was thinking about, and this goes with me making the 5-year plan like I was instructed to by the specialist, were the fact that I would have to adopt, that I was indeed totally comfortable with living as a woman, which I did begin. I was living as a woman for a year before taking on the actual hormonal therapy. Understanding that, because I had the chance and the ability to speak with other transgender individuals that did regret, later on in age, they did regret the fact that they went on the hormone level and they weren't able to make children of their own, or they found that they were indeed into dressing as a woman for sexual purposes as opposed to living it how I live, which is purely something that I feel innately.
How did you go about finding the medical assistance?
Fortunately, I was able to get help with finding the medical assistance, or the reference to finding clinic treatment, through Family Health Services Center here in San Diego, where they have a clinic program on Tuesdays and Thursdays for individuals that would like to transition, whether it be male to female or female to male. And I found this you can either find it through the internet or volunteer participants at the LGBT Center in San Diego.
How do you prepare yourself mentally and physically?
I prepared myself mentally by making sure that after my year of living as a woman, making absolutely sure that this was something that I wanted to do. Because I will say that there was a point of second guessing, do I want to take the steps of becoming a woman naturally through, herbs and vitamins and things of that nature, or did I want to inject a chemical in my body? Because I'm not really into injecting other types of outside medicines or chemicals, so to speak, in my body. But through some soul searching and just a lot of faith in the actual procedure, I did come to grips with actually putting the estrogen inside my body. And after speaking with my doctor, and my doctor working with me extensively on this procedure, to the point where the doctor was making sure to not even put me on the estrogen because of high blood pressure, that I felt comfortable with going with this route. And as far as physically goes, I've had to make sure that my diet was right, my exercise was okay, because the doctors will not allow you to go during this procedure with any type of risk, any health damage. My blood pressure was a little high due to some extenuating circumstances, and I wasn't able to start that procedure just yet, but I'm glad that once we got that nailed down, I was able to start my procedure with the estrogen.
What are the medical expenses to consider?
Now, as far as the estrogen goes, the medical expenses they can be rather pricey depending upon the individual's budget or what have you. Fortunately for me, I was referred to Mom's Pharmacy here in San Diego, which is part of the Being Alive Center, where they help a lot of individuals, and I picked up my prescription with them with no problems. I got it at cost at $150. I don't have medical insurance, but I was able to get my estrogen at cost for $150, and this is actually what the estrogen looks like here. So that little bottle there, that was given to me. It's 40 milliliters, and I'm to take 0.5 milliliters of that every 2 weeks. And with that, also they gave me a free needle, or a packet of free needles, and that needle was used there. But I replaced the bottom needle with this small needle when actually injecting the estrogen. And of course the alcohol swabs, because they promote lots of sterile and cleanliness and disinfectant while using needles. No matter what, it's all about cleanliness and healthy procedure. And that's estradiol. And again, that's 40 milliliters that I'm to take every 2 weeks. Well, no, 40 milliliters, but I'm supposed to take the 0.5 milliliters of that. And now, what Mom's Pharmacy did, I got the estrogen at $150 at cost, but they were kind enough, without me even asking, to set up a payment plan of $30 per month for 5 months. And this will be a continued process and installment as I go through the process, because I believe I'm supposed to take the estrogen for about a year, no, for the rest of my life actually. So this will be a continued process as we continue going along. So fortunately it is, although I'm able to afford the estrogen, I'm even more able to afford it with the payment plans.
And what are the risks to taking estrogen?
The risk to taking estrogen, whether it be in pill or injectable form, can be heart disease, heart attack, or stroke, or blood clots formed in the leg. And again, I took the injectable form of estrogen because I'm 32 years old and I wanted to speed up the process of the physiological change that my body would take. I want my inside to match the physical just as soon as possible. It's not that there's a lack of feeling like a woman, because it all starts, being a woman is state of mind anyway, but I would like to experience the change on a physical level and see what developments take place and whatnot. And again, the hormone process, the injecting the estrogen, that's just the beginning. What the estrogen does is it swells the chest to form more of a breast form. It also creates hips for the shape that women naturally have. And then it will also slow hair growth. It does not, and the other procedures following that I'll have to undertake beyond taking the estrogen, which I'll have to take for the rest of my life. This is a very serious treatment. I will then go with electrolysis, which gets rid of the facial hair altogether, so that will eliminate shaving. Then I will have to undergo surgery, which includes the breast augmentation and also the genital surgery as well. So far, now that this is my second week of taking the estrogen, and again, we're taking the estrogen every 2 weeks. This is my second week. I was told by the doctors that a side effect would be depression or hot flashes. Fortunately, I have not felt any depression or hot flashes. I don't know if it's in part due to me being pretty optimistic, but I have not felt any depression at all. I'm actually quite happy. I feel it's a little bit difficult to explain that I am going through this next phase in my life and something that I call the next evolution. And it's a great change. But thus far, and again, it's the second week, I haven't felt anything as of yet with the depression or hot flashes. At this current phase, all I'm doing is taking the injectable estrogen. That is the first step. As we get further into the year of this new cycle within my transitioning, the next phase will be the electrolysis and the breast augmentation. Now once we get into these procedures, we are getting into a little bit more pricey territory, which requires more work on my part, but it will happen. When there is a will, there is a way. And yes, we'll be having exciting new steps and seeing what physiological changes take place. I'm not quite sure when the actual physical changes will occur as far as the swelling of the chest and the hips should arise, but I'm looking at, we may see results as far as close to 3 months. So by August, there will definitely be some changes within the body. There will be more of a feminine appearance and hips and swelling of the chest.
Will the estrogen have an effect on the tone of your voice?
Now, from my knowledge, I'm told, not by doctors, by other people, by my doctor as well, that the estrogen may or may not have an effect on the tone of my voice. It is said that the estrogen will make it more melodious, however, it won't go higher in pitch. That is a practiced sort of avenue that transgender individuals tend to take. I necessarily won't take that method myself, as it just goes along with the acting and illusion, so to speak. And to me, my transition is not necessarily acting on illusion. Like, it's my life, so I don't need to augment anything of that nature. I'm completely fine with my voice and whatnot. My positive message would be to the young, that generation, teenagers and whatnot, and even the older that feel that now is the time for them to transition into this truth that they want to live. I stress be in a positive frame of mind, be in a positive environment with a lot of support, love and encouragement from your peers and other individuals, because this is beyond any metaphysical belief. It is a difficult journey if you're not of the right frame of mind. You want to be in a right place, and you want to have no fear at all whatsoever in regards to what you may look like physically, what you may get from your family and whatnot. You have to really have no fear and know that this is really something that you want. It is a definite, back to that old saying, once you start it, you can't necessarily go back. And even if even for individuals that do try to go back, it's a little difficult mentally. So you want to be completely balanced in all aspects and be prepared for a lot of criticism and whatnot. And it's only because people don't understand, and but that's okay. Then it's not for them to understand. It's for you to understand and for you to accept. But just remain positive and no fear, and you will be just fine.